Almost everyone experiences lower back pain at some point in life. In fact, back pain is the most common cause of job-related disability and a frequently cited reason for missing work.
Over 80% of people at one time in their life have significant back pain. So that's how common low back pain is.
Fortunately, most low back pain goes away within a few days. However, some back pain lasts much longer and can lead to more serious conditions. Acute or short-term low back pain generally lasts from a few days to a few weeks. Most acute back pain is the result of trauma to the lower back or a disorder like arthritis. Trauma-induced back pain can result from a sports injury, overlifting at work or home, or by a sudden jolt or other stress on spinal bones and tissues. Acute low back pain can range in intensity from a simple muscle ache to shooting or stabbing pain. You may also experience a temporary loss of flexibility and range of motion, or an inability to stand straight. Some acute pain syndromes can become more serious if left untreated. Chronic back pain is pain that persists for more than 3 months. It often gets worse with time, and the cause can be difficult to determine. Whether chronic or acute, back pain can be associated with personal health factors such as obesity, smoking, weight gain during pregnancy, stress, poor physical condition, bad posture, and poor sleeping position. To understand back pain, it may be helpful to understand the back's anatomy. The spinal column is made up of 30 bones or vertebrae. Inside this column lies the spinal cord. The spaces between the vertebrae are cushioned by cartilage called intervertebral discs. Ligaments and tendons hold the vertebrae in place and attach the muscles to the spinal column. When you overstretch or lift something too heavy, it can cause a sprain, strain, or spasm in one of the muscles or ligaments in the back. If the spine becomes overly strained or compressed, a disc might rupture or bulge outward. This rupture may put pressure on one of the more than 50 nerves rooted to the spinal cord and cause pain.
And I think practically all of us, unless we've made a mistake and been taught what to do correctly, all of us make the mistake of bending over from the waist to lift something up rather than squatting down to lift and use our thighs. Even bending over at 30 degrees to lift a 30-pound object puts over 400 pounds of stress on the lumbar vertebra. So it's just not designed to take that kind of a workload.
Many times, low back pain can be treated without surgery. The goal of treatment is to alleviate pain and reduce inflammation. Meanwhile, it is important to gradually restore proper strength and function to the back. Most people with back pain recover without permanent injury. One way to treat acute and chronic low back pain is through over-the-counter or prescription medication. Just remember, always check with a doctor before taking any drugs for pain relief. While hot and cold compresses have never been scientifically proven to quickly resolve low back injury, compresses may help reduce pain and inflammation and allow greater mobility for some individuals. Your doctor may also recommend that you rest or sleep on your side with a pillow between your knees. And while bed rest may be appropriate for 1 to 2 days, most healthcare experts agree that patients should resume activities as soon as possible. Your doctor or physical therapists can provide a list of gentle exercises to keep muscles moving and speed the recovery process. Keep in mind that occasionally, low back pain may point to a more serious medical problem. If your pain is accompanied by the loss of bowel or bladder control, you should call 911 immediately. While other symptoms may not necessitate emergency medical attention, you should still see your doctor if you experience any of the following: unexplained fever with back pain after a severe blow or fall, redness or swelling on the back or spine, pain traveling down your legs below the knee, weakness or numbness in your buttocks, thigh, leg, or pelvis, burning with urination or blood in your urine, or very sharp pain. Also call if this episode of back pain has lasted longer than 4 weeks, or if there is not a noticeable reduction in pain and inflammation after 72 hours of self-care. The good news is that some back pain is preventable.
There's the treatment directed at sort of undoing or treating the acute problem and trying to reduce the pain and get their flexibility back. But then once that phase is over, I tend to send my patients to physical therapy for a one-time back education instruction, and also instruction then about, if they're not in good physical shape, about strengthening the core muscles and exercises that help with flexibility of the back. And then that's really their responsibility to, unfortunately, it's not a quick fix, to do it on a regular basis because the back tends to get weak.
Here are some tips for improving the health of your back. Engage in regular low-impact exercises such as speed walking, swimming, or stationary bike riding. Gently stretch before exercise or other strenuous physical activity. Avoid slouching and try to keep your weight balanced on your feet when standing. Choose chairs with lumbar support and place work surfaces and foot supports at a comfortable height. Switch sitting positions often and take breaks. Sleep on your side to reduce any curve in your spine. Don't try to lift objects too heavy for you. Lift with your knees. Pull in your stomach muscles and keep your head down and in line with your straight back. Keep the object close to your body and do not twist when lifting. If you smoke, quit. Smoking reduces blood flow to the lower spine and causes the spinal discs to degenerate. Maintaining a healthy weight will help too. Back pain should never be ignored. If the cause of your back pain is serious, your physician will help you decide what measures to take. In many cases, however, following back healthy practices may help alleviate existing pain and help you avoid injury in the future.